Nurse Aide Test Prep Download. Question 1. A client is grieving the loss of their spouse. The nurse aide should: Option A. Tell them to move on and focus on their health. Option B. Listen and acknowledge their loss. Option C. Avoid mentioning the spouse to prevent sadness. Option D. Suggest they should be grateful for the time they had. The correct answer is option B. Listen and acknowledge their loss. Listening and acknowledging the loss validates the client's grief. Telling them to move on or that they should be grateful dismisses their feelings. Avoiding the topic leaves them isolated. Question 2. What is the correct position for a client receiving oral care to prevent aspiration? Option A. Supine position. Option B. Fowler's position. Option C. Prone position. Option D. Sims position. The correct answer is option B. Fowler's position. Fowler's position, semi-sitting, prevents aspiration by allowing gravity to aid swallowing. Supine, flat, increases aspiration risk. Prone is not appropriate for oral care. Sims is used for enemas and rectal procedures. Question 3. When using a fire extinguisher, the nurse aide should remember the acronym. Option A. Pass, pull, aim, squeeze, sweep. Option B. Race, rescue, alarm, contain, extinguish. Option C. ABCD, airway, breathing, circulation, defibrillation. Option D. Pace, pull, aim, contain, extinguish. The correct answer is option A. Pass, pull, aim, squeeze, sweep. PASS is the correct acronym for using a fire extinguisher. RACE is for fire response, rescue, alarm, contain, extinguish. PASS is specifically for extinguisher use. Question 4. What should the nurse aide do first for a client who has fallen? Option A. Move the client to their bed. Option B. Assess for injury and call for help. Option C. Document the fall. Option D. Call the client's family. The correct answer is option B. Assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 5. The nurse aide is caring for a client who speaks a different language. The best approach is to: Option A. Use hand gestures and hope the client understands. Option B. Speak loudly and slowly. Option C. Use a trained medical interpreter. Option D. Ask another client to translate. The correct answer is option C. Use a trained medical interpreter. A trained medical interpreter is essential for accurate communication. Hand gestures are insufficient. Speaking loudly doesn't help. Using another client violates confidentiality and may result in errors. Question 6. To prevent aspiration during feeding, the nurse aide should: Option A. Feed the client lying down. Option B. Feed the client with their head tilted back. Option C. Feed the client in an upright position. Option D. Feed the client only pureed food. The correct answer is option C. Feed the client in an upright position. Upright positioning, Fowler's position, 45 to 90 degrees, allows gravity to help food move down and protects the airway from aspiration. Lying down or tilting the head back increases aspiration risk. Question 7. When a client dies, the nurse aide should: Option A. Leave the room immediately. Option B. Provide post-mortem care. Option C. Call the family. Option D. Remove all personal belongings. The correct answer is option B. Provide post-mortem care. Post-mortem care, bathing, positioning, and preparing the body, is the nurse aide's responsibility. Leaving the room is not appropriate. Calling the family is usually done by the nurse. Removing belongings should be done carefully and respectfully. Question 8. A client who is confused becomes agitated. The nurse aide should: Option A. Give the client a sedative. Option B. Remove the client from the situation. Option C. Use a calm, reassuring voice. Option D. Tell the client to calm down. The correct answer is option C. Use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 9. A client with Alzheimer's disease gets upset because they cannot find their deceased spouse. The nurse aide should: Option A, remind the client that their spouse is dead. Option B, gently redirect the conversation to a pleasant memory of the spouse. Option C, tell the client to stop worrying. Option D, call the nurse to explain the situation. The correct answer is option B. Gently redirect the conversation to a pleasant memory of the spouse. Redirecting to a pleasant memory validates the client's feelings while avoiding the distressing reality. Reminding them the spouse is dead may cause repeated grief. Dismissing their worry doesn't address the emotion. Question 10. The nurse aide's responsibility with advance directives includes: Option A, helping the client complete advance directives. Option B, honoring the client's wishes and informing the nurse. Option C, making decisions for the client. Option D, explaining advance directives to the family. The correct answer is option B, honoring the client's wishes and informing the nurse. The nurse aide must respect and follow advance directives and inform the nurse of any issues. The aide does not assist in completing advance directives, make decisions for the client, or explain legal documents to the family. Question 11. After giving a client a back rub, the nurse aide should always note: Option A, the last time the client had a back rub. Option B, any change in the client's skin. Option C, the client's weight. Option D, the amount of lotion used. The correct answer is option B, any change in the client's skin. The nurse aide should document any skin changes observed during a back rub, such as redness, dryness, or breakdown. This is part of routine skin assessment and helps prevent pressure ulcers. The amount of lotion used, last back rub, and weight are not the primary observations to document. Question 12. A client is in the active dying process. The nurse aide should: Option A, avoid the client. Option B, provide comfort measures. Option C, stop all care. Option D, leave the client alone. The correct answer is option B, provide comfort measures. Comfort measures such as repositioning, mouth care, and emotional support are essential at the end of life. Avoiding or leaving the client alone is not appropriate. Stopping all care would be neglect. Question 13. The chain of infection includes: Option A, pathogen, host, transmission route. Option B, air, water, food. Option C, bacteria, viruses, fungi. Option D, skin, blood, mucous membranes. The correct answer is option A, pathogen, host, transmission route. The chain of infection consists of infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Understanding the chain helps identify how to break transmission. Example, hand hygiene breaks the mode of transmission. Question 14. Which of the following items is used in the prevention and treatment of bed sores or pressure sores? Option A, rubber sheet. Option B, air mattress. Option C, emesis basin. Option D, restraint. The correct answer is option B, air mattress. An air mattress, or pressure-reducing mattress, helps prevent and treat pressure ulcers by redistributing pressure on bony prominences. Rubber sheets can trap moisture and increase skin breakdown. Emesis basins are for collecting vomit. Restraints are not used for pressure sore prevention. Question 15. What should the nurse aide do if a client's oxygen saturation drops to 90%? Option A, increase the oxygen flow. Option B, report it to the nurse immediately. Option C, reposition the pulse oximeter probe. Option D, document the reading. The correct answer is option B, report it to the nurse immediately. An SpO2 of 90% is below normal, 95 to 100%, and requires immediate reporting. CNAs cannot adjust oxygen. While repositioning the probe might be attempted, reporting to the nurse is the priority. Question 16. A client who is anxious and pacing should be: Option A, placed in a chair and restrained. Option B, encouraged to talk about what is bothering them. Option C. Given a sedative. Option D. Ignored until they calm down. The correct answer is option B. Encouraged to talk about what is bothering them. Encouraging the client to talk about their concerns helps identify the cause of anxiety and may provide relief. Restraint is inappropriate for anxiety. Sedatives require a physician's order. Ignoring them leaves them to suffer alone. Question 17. Normal adult resting heart rate range is: Option A, 40 to 60 beats per minute. Option B, 60 to 100 beats per minute. Option C, 80 to 120 beats per minute. Option D, 100 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. The normal resting heart rate for adults is 60 to 100 beats per minute. Rates below 60 may be normal for athletes but are considered bradycardia. Rates above 100 are tachycardia and require reporting. The other ranges are outside the normal adult parameters. Question 18. The nurse aide should wear identification. Option A. On their arm. Option B. On their upper chest at all times. Option C. On their back. Option D. Tucked in their pocket. The correct answer is option B. On their upper chest at all times. ID badges should be worn on the upper chest at all times for easy identification by clients, families, and other staff. Visible ID builds trust and meets safety standards. Question 19. Restorative care focuses on: Option A, curing the disease. Option B, maintaining and improving function. Option C, providing end-of-life care. Option D, replacing the client's abilities. The correct answer is option B, maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 20. The nurse aide should report which finding as a possible sign of abuse. Option A, bruises at different stages of healing. Option B, bruises on the shins. Option C, a client who is hard of hearing. Option D, a client with memory loss. The correct answer is option A, bruises at different stages of healing. Bruises at different stages of healing, varying colors, are a classic sign of abuse. Bruises on shins are common from minor bumps. Hearing loss and memory loss are health conditions, not necessarily signs of abuse. Question 21. A client is angry and yelling. The nurse aide should: Option A, yell back at the client. Option B, leave the room and return later. Option C, listen to the client's concerns and remain calm. Option D, call security. The correct answer is option C, listen to the client's concerns and remain calm. Active listening without defensiveness de-escalates anger and shows respect. Yelling back escalates. Leaving may be necessary if the client is a danger, but listening is the first approach. Security may be needed if the client is a danger to self or others. Question 22. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D, remove the food after 15 minutes. The correct answer is option B, provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 23. A client is having a seizure. The nurse aide should: Option A, put a spoon in the client's mouth. Option B, hold the client down to stop the seizure. Option C, clear the area and turn the client to their side. Option D, leave the client alone. The correct answer is option C, clear the area and turn the client to their side. During a seizure, clear the area, turn the client to their side to prevent aspiration and protect the head. Putting anything in the mouth can cause injury. Holding the client down can cause fractures. Question 24. When taking a client's oral temperature, the nurse aide should place the thermometer. Option A, under the tongue. Option B. On top of the tongue. Option C. Between the cheek and gum. Option D. Under the arm. The correct answer is option A. Under the tongue. The sublingual pocket under the tongue is the correct placement for an oral temperature. This area provides accurate core temperature readings. Placing on top of the tongue or between cheek and gum does not provide accurate readings. Under the arm is the axillary method, not oral. Question 25. A client with depression refuses to get out of bed. The nurse aide should: Option A. Allow the client to stay in bed. Option B. Gently encourage the client to get up. Option C. Force the client to get up. Option D. Call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care.